Of the 1 million heart attacks that occur in the U.S. every year, 375,000 are ST elevation myocardial infarctions, involving large coronary thrombi that are eligible for thrombectomy. In addition, each year over 200,000 patients with peripheral arterial disease are in need of clot removal. Rapid and complete removal of arterial clot from either coronary or peripheral arteries can potentially salvage tissue, improve clinical outcomes, and reduce mortality. Unfortunately, existing thrombectomy devices suffer from major limitations. Simple aspiration catheters often leave 30 to 50% of the clot behind. Multiple catheter exchanges are needed when large clot is present. In addition, mechanical thrombectomy devices are associated with a high risk of adverse events, particularly distal embolization. Fragmentation of the clot during thrombectomy frequently occurs, sending hundreds or thousands of emboli distally, which leads to reduced blood flow, tissue death, and significant morbidity and mortality. The MegaVac vacuum extraction thrombectomy system solves limitations of existing technologies, setting a new standard in clot removal. The MegaVac is actually 4 devices in one. It occludes the artery completely. It protects against embolization. It acts as an anchoring device. And it rapidly, completely, and efficiently removes arterial thrombus. Let's watch how MegaVac vacuum extraction thrombectomy works. The catheter is first positioned just proximal to the clot. The funnel mouth at the tip of the catheter is then deployed, occluding blood flow with its silicone elastomer on the distal aspect of the funnel. This results in the mouth of the funnel tip being maximally expanded in a radial fashion by the patient's own blood pressure, creating a seal against the arterial wall and arresting blood flow. Cessation of blood flow prevents clot fragments from traveling downstream, greatly reducing the potential for distal embolization. The patient's blood pressure, along with the radial force of the funnel tip, combine to press the device against the arterial wall, anchoring the catheter firmly and safely. The outward expansion of the MegaVac anchors and centers the device and can be used as an anchor for other devices in crossing tight lesions or tortuous vessels. Once the MegaVac arrests blood flow, the thrombo wire is inserted through the catheter, advanced through the clot, and deployed distal to the clot. While applying suction with the MegaVac, the thrombo wire is retracted to simultaneously pull the clot into the funnel mouth and through the catheter. After complete clot removal, suction is discontinued and the catheter tip is undeployed, restoring distal blood flow. Rapid removal of occlusive thrombus with vacuum extraction can accelerate door-to-balloon time and improve outcomes. In summary, there is currently a large unmet need for rapid and efficient thrombus removal in cases of coronary and peripheral arterial thrombosis. The MegaVac system provides a 4-feature solution in one device: occlusion, protection, anchoring, and removal. MegaVac is easier to use, with the potential to be safer and more effective than current devices, which translates into improved blood flow, less tissue death, and more patients' lives saved.